Hi guys, um, here are a few tips for the general gynecology module for the part 3 exam. The template remains the same, so you start with the introduction, set the agenda, come to the information gathering. Now in the information gathering, these patients, the role player may be presenting with sometimes severe pain. If that is the case, if she is in acute pain, then go for relieving that first. Rule out allergies, give her a painkiller. Many a times in this module there are multiple symptoms that are there. For example, there may be pain, there may be bleeding, there may be some lump felt, multiple symptoms. Then you need to address each one in the history of presenting illness, go into the details of all of these. For example, if there's bleeding, ask about the quantity, the nature of bleeding, how many pads in a day, whether it's associated with passing of clots, how many days, and all the details of each symptom that is there. If there's some mass which is likely to be malignant, then to rule out malignancy, keep some questions ready in your mind, like you can ask about loss of appetite, loss of weight, any shortness of breath, those kind of things to rule out malignancy. Rest of the template will remain the same. You will of course start with the gynae history first and then the obstetric history. One very important point in this is that you will always ask about the future obstetric plan for this patient, because management many a times depends on that, whether she's planning a pregnancy in the near future or not. Rest of the template will remain the same. The medical history, surgical history. Yeah, one more important point in general gynec is when you are asking about the sexual history, always never forget to signpost first, ask whether she is sexually active, and go ahead with asking the rest of the questions. So for signposting, you will always say, I'm sorry, but some of my questions may sound a little intrusive, but they are important to reach to a proper management plan. Then ask about whether she's active, and then go on with whether she has any history of sexually shared infections or whatever is relevant to the case, right? Rest of the template will remain the same. The medical, surgical, family, personal, social. Also ask about the BMI, the blood group, because there may be a surgical intervention that is required. After the information gathering, we come to explaining the condition. Here you always remember to draw and show wherever relevant. Then the management. One very good thing to remember here is in general gynec usually there are multiple options of management, right? So always make sure that you name all of the options that are available. For example, the medical, the surgical, whatever options are available in medical, whatever options are available in the surgical, all of them you mention first, so that the examiner knows that you know all of these. But of course one will be more appropriate for the patient. So after naming all of them, come to however this option is the best for you in this case, and then go into the details of that particular mode of management, and then elaborate on that. And of course, like always, end with answering all her queries and giving her a information leaflet. Also in some cases admission may be required if it's some kind of acute pain or retention or anything. Then talk to her about admission and complete those formalities, and end with a patient information leaflet after telling her in detail about the management options. Thank you.